Okay, so our project that we decided to work on was schizophrenia misdiagnosis in the Black American community, uh, and plans to address that. So I'll go ahead and start here. My research article involves an analysis of prior existing models that commonly assess schizophrenia in patients such as the BPRS, the CANS, and CDI inventory. They found that minimal bias occurred in the BPRS model, and most of the bias was observed in the CANS and CDI models. The team's plan was to integrate a cultural training program with the existing BPRS model for assessment to seek lower misdiagnosed Black patients. The results were significant with a reclassification of diagnosis in Black patients at 40.6%. The team suggests implementing cultural competency training in conjunction with the already in use model of the BPRS model so that healthcare professionals can help lower the overall misdiagnosis in Black patients. If someone else wants to go next.
The rates of diagnosis among African Americans is elevated compared to other racial ethnic groups in the U.S. clinical settings. This is due to racial differences in clinical diagnosis, which are two factors that could be, which is the biological and social environment factors that could be more susceptible for ethnic groups, such as schizophrenia. The hypothesis of my article discusses that racial bias in the diagnosis of schizophrenia spectrum disorders and parts of clinicians, they overemphasize the psychotic symptoms over the relative symptoms of mood symptoms among African Americans compared to other racial ethnic groups. This is also due to the assessed number of first rank psychotic symptoms among African Americans versus the white patients. Um, these observations suggested that African Americans' psychotic symptoms are more excessively weighted by clinicians, skewing their diagnosis towards schizophrenia spectrum disorders, even when the patients had ratings of depression and manic symptoms. And this determines whether clinicians fail to effectively weigh mood symptoms when diagnosing schizophrenia or schizoaffective disorder among African Americans. Schizophrenia results from clinicians underemphasizing the relevance of mood symptoms. This is also could be an unconscious or conscious towards them or the effects of clinician with racial. So a screening for a major depression in settings as schizophrenia could be a more accurate assessment for the schizophrenia, for it could also be that they do not meet the criteria of schizophrenia and could follow up with more psych interventions.
Black Americans have been diagnosed with schizophrenia more than twice the rate as white Americans. Diagnosed with schizophrenia or schizoaffective disorder. Multiple assessments analyze symptom severity, neurocognition, and social cognition between Black and white Americans. Results from the study showed significant differences in symptom severity, with Black individuals having higher scores of disorganized thoughts and symptoms compared to white individuals. Results also demonstrated lower cognitive performance in Black individuals, with other studies showing racial disparities in cognitive assessments through assessment and there were no significant differences between functioning of social cognitions. Studies will demonstrate higher rates of positive symptoms among Black individuals compared to white individuals.
My article discussed comparing symptoms and emotional recognition in African Americans and white samples with schizophrenia. The racial status has an important role when it comes to schizophrenia or presentation. Comparing the rates of samples that clinicians were using, they found that African Americans were rated as experiencing more of the severity of symptoms and didn't perform well when it came to emotional recognition compared to white participants. The study recognized that in the past, their racial differences were most likely manifested in different kinds of item-related differences, as opposed to the overall psychosis scores that were being compared. Two of the key factors that were being assessed were emotional recognition being the main component, and social cognition, which is emotional cognition focuses on the perception of different cues that are being displayed. The limitation that was in the study showed the lack of research being collected due to the lack of demographic data. This caused the studies in the past to be adjusted, and this would explain why African Americans would be diagnosed more than white participants. So during the current study they were conducting were examining the differences in the symptoms and emotion recognitions while observing to see if there was distinct differences between both African Americans and whites with schizophrenia, while observing the different demographics at the same time, which these included the following symptoms of hallucinations, delusions, and suspiciousness. The participants that were in the studies were pulled from rehabilitation and cognitive behavioral interventions, which they had used different assessments to assess the different social cognitive performances that were on the baseline treatments. And the overall conclusion was that it found that there were racial differences in emotional recognitions, but not in symptom severities.
Okay, yeah. So for the discussion portion, was there anything, so we've noticed obviously that there's biases in not only the application of healthcare and mental health care, but it seems to be there's a lot of biases in the data as well. Unfortunately, there's not enough data, is what I'm noticing, and we need more data specifically on Black patients and um, misdiagnosis and seeing like where they're actually at with their diagnosis, like if they even have a mental illness to begin with. Because some of the cases I was looking at, they don't even they just had expressed like depression and it was misdiagnosed as schizophrenia.
Right. Yeah, I think with reading through like my article, like there are like Black individuals do have to undergo a lot of different like experiences. I mean, they do deal with more racism and discrimination and bias, which could have a lot of environmental impacts on how they may be portrayed or act or whatever the situation may be, which could also cause misdiagnosis in any mental health diagnosis, but schizophrenia, too, with what I've kind of noticed with all of our discussions is that schizophrenia has just been highly misdiagnosed between Black individuals compared to white individuals. And there could be a lot of environmental like reasons for that. So I think there needs to be definitely a lot more research on the topic, just with mental health in general, too. I think there needs to be a lot more research done on Black individuals compared to white. And then I think when we were discussing earlier, you had mentioned something about like different sexes, like the differences between like male individuals and female individuals. Remember?
There is clinician bias when it comes to schizophrenia and racial ethnic background. And it could be, as I said, conscious or unconscious bias. And this is due because of the psychotic features or hallucinations, but not the bizarre behavior of an individual. So that just goes into the fact that inaccurate diagnosis could have consequences for the treatments because there are mood disorders or there could also be substance abuse, and that could be a prognosis for selecting an effective treatments for African Americans, and it could produce consequences such as worsening morbidity or suicide, and then also just failure to recognize alternative diagnosis for individuals.
I think that schizophrenia just being in general like a very hard diagnosis to figure out and have symptoms show, but having African Americans not have or not being able to pull data for African Americans is a little bit harder as opposed to the pulling data from whites is a little bit more easier, I would say, but for pulling off like getting data and collecting data for African Americans is a little bit harder. So I
Yeah.
think not only diagnosing it, but finding a group like finding a good like collective study and data pulling from African Americans is a little bit harder than as opposed to whites.
Yeah, I read also like from a cultural and a social perspective, it very well also could be this is outside the range of our studies, but it very well also could be that um given the like typically lower socioeconomic status of Black Americans, it's like incredibly difficult, probably, I would imagine, to get healthcare. I mean, it's hard to get healthcare even as someone who works. And so it kind of seems out of reach, probably. I have to imagine going to a therapist or anything, mental health related would just be incredibly out of reach because it's like you're worried about so many other things, like your job, your family, um, and not to mention like men tend to not go as much. So the data is just not gonna be, it would be important, I think, in the future to incentivize somehow, just, I don't know if it's through free therapy or something, but just incentivize data in that community so that we can have more data and understand it better.
Right.
I also feel like that goes into the fact that certain African Americans don't feel comfortable actually trusting the clinician that they're talking to.
Yeah.
So giving the full prognosis of like their symptoms, trustworthiness, feeling hopeless, or not feeling safe with that clinician could also be factors, such
Mhm.
as explaining the symptoms accurately. So that could also go. And then also because a lot of the mood symptoms can go into major depression, which is one of the symptoms for schizophrenia, and which is why Black individuals are more likely to be diagnosed with it. But there are other factors, as you guys said, socioeconomic, stress, jobs, and like just overall just not ruling out other mood symptoms, and then therefore they're being misdiagnosed for schizophrenia and not meeting certain criteria when it comes to the mood symptoms.
Right.
Yeah, it seems to me that external um, problems are directly affecting data and research here, which is directly affecting application of said research in healthcare. So it seems to me that the problems that are happening out there in the world are also happening in the research.
Mhm. Yep.
Do you think the stigma has a potential like effect on the schizophrenia, like African Americans being seen as more aggressive in the stereotype as opposed to whites because they don't really label there's like a stigma, the stereotype as to put like for African Americans being more aggressive, as to like whites, they're not really aggressive, they're not portrayed as in that way, just kind of like how people kind of see them contributes to being make diagnosed.
Yeah, because in my article it went about an assessment that was a unblinded commission evaluation, and it showed that it says that psychotic symptoms more for African Americans than for mood disorders. I mean, for mood symptoms, and for white people, they took more an assessment, their mood symptoms than the psychotic symptoms, such as mania or any hallucinations. So it went more with like they emphasized psychotic symptoms more than their mood, which is why they met criteria for psychotic symptoms and not the mood symptoms, which goes into the fact that there is not criteria being met. And so I feel like there is some stereotype into that and just going into just assessing that into schizophrenia.
Mhm.
Yeah, definitely. I think my article mentioned even too that like even for well-meaning practitioners, implicit bias unfortunately still just has a hold over judgments.
Mhm. Yeah. I mean, I think that might be a common like consensus between our articles because I mean, that was a big thing in my article was the effect on racism, discrimination, bias. I mean, it had even mentioned like restricted access to jobs and education and medical care because that is just unfortunately something that Black Americans do face is all of this racial discrimination that could limit, access to healthcare and being diagnosed with schizophrenia because of like how they're portrayed as like aggressive and I don't know, but yeah, I think just with how societal like effects are like unfortunately there's just a lot of bias, even when you just walk in, or like you're a practitioner and you just have like a Black American walk in, like everyone does, but like you have a bias on this person. And like I think research needs to like really know the importance to try to push that bias like to the side and like actually focus on the patient and what symptoms they are portraying to see if it's actually correct to diagnose them with schizophrenia or if it's just a major depressive disorder.
Yeah,
Oh,
definitely.
yeah. Um,
Okay.
in my article, it talks about just ruling out substance abuse as well. So I feel like that goes into it because I feel because you're always around stress and trying to alleviate it and having depression, all these symptoms, it could go into other ways of reducing that stress, which could go into substance abuse. And I feel like that's the first thing you should rule out when it comes to
Mm-hmm.
personality disorders because substance abuse can give inherently some of those symptoms. And in my article, it talks about substance abuse within African Americans and it not being ruled out. So I feel like there is that factor into that as well.
Right.
Yeah. Yeah, definitely. Okay. I think that's good. Does anyone else want to say anything? Okay, cool. Alrighty. Thank you. Cool. So, let's see. That is our research project about schizophrenia misdiagnosis in Black Americans. Thank you for listening.